Hello, my name is Blessing. I'm a family planning nurse. Modern family planning contraceptives offer a more reliable and proven way of spacing or limiting family size. However, some of these contraceptive methods are associated with undesirable effects which are commonly called side effects. One of the most common side effects is bleeding. It commonly occurs with the hormonal contraceptives such as implants and injectables, and with the intrauterine contraceptive device commonly known as IUD or IUCD. So today, I'll be talking about managing bleeding as a side effect. Commonly, complaints range from spotting to heavy bleeding and sometimes prolonged bleeding. Whichever bleeding occurs, it's important to reassure clients that symptoms will likely resolve within 3 months. Every family planning service provider should have a copy of the National Family Planning Standard Operating Procedure, which clearly outlines how to manage such bleedings. Our discussion will be centered around these guidelines. Sometimes, clients panic and return to the clinic when they experience these side effects. It is our responsibility to reassure and manage them because these side effects usually reduce to the point of acceptance with continued use of the same method. Now, let's talk about what to do when a client complains about bleeding as a side effect of modern contraceptives. The first thing to do is to take a detailed history to establish the cause and understand the pattern of the bleeding. Inquire if it coincides with the timing of the contraceptive. Ascertain the duration and quantity of the bleeding. Establish if the bleeding is severe enough that there are associated signs and symptoms. Inquire if the client has any associated symptoms such as abdominal pain, any abdominal vaginal discharge, weakness or dizziness. If a client is experiencing symptoms such as fainting or severe abdominal pains, this can suggest that the bleeding is severe and should not be overlooked. Next, do a physical examination. Ensure you carry out a thorough examination which involves general examination, with emphasis on checking for pallor, checking the client's blood pressure and the pulse. Abdominal examination. Check for any abdominal tenderness, pain, swelling, and check for pregnancy-related complications. Check if the contraceptive is still in place in the case of an IUD or implant. If the implant or IUD is still in place and the bleeding started after initiation of contraceptive, take time to reassure the client and explain that bleeding changes are common in women who use implants, IUDs, and injectables. Explain that they are not harmful and bleeding will usually become less or stop altogether after the first year of use. If the client, however, finds the bleeding unacceptable and there is no estrogen contraindication, refer to the National Family Planning Operating Procedure and follow the steps outlined for the management of bleeding as a side effect. If bleeding is very heavy, twice as much as usual, ensure that you 1. Check for infection and anemia. If present, treat and refer. 2. Advise on food containing iron or give iron tablets. If bleeding is unacceptable and the client feels it's a health threat, counsel her to choose another method and remove the implant or IUD or stop the injectable as the case may be. However, ensure that you provide the client with a stopgap method for the interim before she takes up another contraceptive method. Always remember that uterine evacuation is not necessary and it's contraindicated. With these steps, you can effectively manage bleeding as a side effect associated with modern contraceptives. Endeavor to help your clients from today. Thank you.
Get it together for a brighter future.